Hello friends, my name is Sophie and we are going to be doing IV insertion today. So I have already done my hand hygiene, I've washed mis manos, and it's time to go. So first we're going to talk to Greg here, he's our patient. Hello Greg. Can I see your identification band? Thank you. What's your birthday, Greg? 4/24/1997. Wow. Very cool, dude. You're 22. Me too. We're going to be doing an IV administration on you today. There's some reasons that you could have IV administration is you can't take medications orally, and you need a tight schedule on your medications like antibiotic medications. And you could need medications quick, fast, and in a hurry, or in an emergency manner, so it goes right on into your veins and affects you immediately. So, or you could be getting surgery and need medications through the IV that way. All right. These are IV Start Supply Kit contents. We're gonna need gloves. That's obviously really important, because we don't want our hand germs to get on the site. We're going to need tourniquets that fit the patient's arm, and then we're going to need alcohol prep pads, which clean the site and doesn't make sure an infection doesn't start. Then we're going to need these gauze thingies to make sure if any excess blood occurs that we can clean it up promptly. And this is our IV catheter that we're going to insert on the patient, complete with a needle, the catheter, and the clamp and places to put the saline. And then of course the tegaderm and the tape to hold the tegaderm in place. And I'm pretty much ready. All right friends, I washed my hands and now I'm going to put on this tourniquet because it's hard with gloves. Excuse me, Greg. Try not to do this for too long. There you go, buddy. That's Greg's brother. These are really tight gloves. Okay. So now that I have my gloves on, I'm going to locate a vein. This doesn't happen very quickly. It's because you gotta give it time to, puff out a little bit. Alright, I think I've found one of my veins that I want to work with because it's in a straight line and it's indicating that it's one of the veins I want to poke, not one of the bad ones, arterial ones. So I'm going to get my catheter a little closer to me, and then I'm going to get my alcohol prep pad and prep the site for what I'm going to insert the needle into. You're doing great, Greg. Don't be nervous. Okay, so I'm going to get my IV catheter, make sure it is unclamped, withdraw the protective needle port, then we're going to insert it at an angle into Greg's vein. Hopefully we get a flash here. Interesting, Greg. I'm gonna have to fish around here. Your blood. Well, this isn't looking very attractive right now. Well, that didn't work. So we're going to locate a different vein. This is a different catheter needle because we need to keep sanitary measures in mind. So I'm going to prep this vein and hopefully we will have better results. Alrighty then. Okay. Going to insert it at an angle There we go. I see a little something. Alright, now we're just going to push a little further. Why isn't it undoing the do? Okay, there we go. We're gonna retract the needle as we put in the catheter. And just gonna leave it like that. Gonna put this tegaderm on there so that it stays in place. Oh yeah, that's exactly where we want it. Greg has a good looking IV there right now. Perfect, and now we are going to flush the IV. I'm going to clamp it so the blood doesn't get everywhere. That would be kind of hairy. Okay, we're going to unclamp the dealie. We're going to flush it. We can even pull back and see if we get blood return, which we do. So we're just going to keep flushing until he has a clean line. Thank you, Gregory, for letting us put this IV on you. And then lastly, but not leastly, you're going to put tape to secure the IV further so good old Greg doesn't rip it out, which would not be good. This tape is not really saying yes to me right now, but it's okay. Just gonna put it right there. So that catheter is there and there to stay. Right. So now, as a nurse, we want to watch Greg's insertion site for some adverse effects that could occur to him, like infiltration, which is where the catheter is sitting in subcutaneous tissue instead of the vein and is administering IV medications or liquids to the subcutaneous part of their skin, which is kind of bad because it results in coolness of the skin, possibly some redness, some swelling, and we really don't want that for our patient because that is just not good. And we're also going to monitor for infection. So if you put an IV needle in, you want to monitor the skin for any overlying infection like cellulitis. And we also want to make sure we clean the site before we put the IV needle in. But some signs of infection would include pus at the IV site, redness, fever, tachycardia, and other manifestations that the patient will be experiencing an infection. And blowing the vein is never good either. We want to make sure that we insert the needle at a proper angle and don't go out the other side of it, because that is just damages the client's blood vessels. So yeah, those are some contraindications of IV insertion.